Parties involved in the consultation process say guidelines for nurses wearing tudungs during work should be broad enough to cover different kinds of scenarios. These include when the tudung can be worn or what kind should be worn so as to ensure workplace safety for nurses and patients. Nisha Rahim with more.
Senior radiographer Nia Nishita has more opportunities to wear tudung while at work compared to her colleagues who are predominantly in uniform, like when in low-risk scenarios when there's no close contact with patients. But this isn't always the case.
When we're paying closer attention to infection control, because patients who come through our doors are more sick and they're more likely to they're more vulnerable to infections and developing they're more prone to infections basically. So we are even more particular with regards to infection control.
The new guidelines developed by committees appointed by the Health Ministry is expected to provide clarity on several areas. This includes when and where the tudung can be worn.
So in areas where a higher level of cleanliness is required, like for example in the operating theatres, it may not be possible to wear a personal tudung. Or in areas where staff today have to don full PPE, then the tudung may be seen as, something that can interfere with the fit of the N95 mask. And so I think then surgical caps or disposable tudung, if that is available, may be a better option.
She adds that certain institutions like those that have been very aggressive or challenging patients will need to perform risk assessment on the suitability of wearing one. As to the material of the tudung, Singapore's climate is a factor, especially for those nurses working in non-air conditioned areas.
As they wear the tudung, will be something that's comfortable for them because it's going to be a daily wear. And then, of course, in the current context of about our environment, right, in a tropical climate like Singapore where there's heat, humidity, how would that impact them?
Starting November, Muslim nurses in the public healthcare sector can wear a tudung if they wish to. The Health Ministry says this will apply to more than 7,000 employees.